Okay, my name is Maggie Morrissey, and I will be talking about abuse towards children with disabilities. So, some statistics on this: there are approximately 360,000 children under the age of 16 in the United States that have one or more disability. That's about 3% of all children. Over 120,000 children with disabilities have problems with communications, which plays a huge role in their abuse and neglect. So, what is a child with medical complexity? Children that have special healthcare needs are those who have or are at decreased risk for chronic physical, developmental, behavioral, or emotional conditions. It also is any child who requires health related services of a type or amount beyond what a healthy child would require. So, what is medical neglect of child with medical complexity? According to the Treatment Act of 1974, it is failure to provide adequate medical care. After the Treatment Act of 1974, there were specific laws and regulations about reporting medical neglect, but it was left up to each state to develop. In Missouri, it is when a mandated reporter finds reasonable cause to suspect regarding any type of abuse, then they must report it. This goes for any child, regardless of if they have a disability or not. So there are six crucial steps to address medical child abuse. So first, you must address that the abuse has occurred. Then you must stop the abuse from occurring. Then the third step is providing for ongoing safety of the child. Four is treat the physical consequences of the abuse. Number five is treat the psychological consequences of the abuse. And number six is try to maintain integrity of the family. It is very important to follow all six of these steps during the process. And it is pretty important to try to follow them in this order. So, this is a sheet that I found online that I think is really beneficial for just like a starting point, because I feel like a lot of people, when they think of children with disabilities, they don't really know how to prevent the neglect and abuse. They might not know where to start. And I think right off the bat, just knowing how to act and talk around a person with a disability is really important and beneficial. So, this just lists 10 steps in 10 different ways to make sure that you communicate with them properly and this and treat them like a normal person. And I think following at least these 10 steps can really change a whole outlook on how you treat a child with a disability, whether they are your child or just somebody you know. So, this is a first solution that I think would be really beneficial is for people to look at this worksheet and utilize it. So the next couple slides can be a little trigger warning. So the first thing I want to talk about is sexual education with children with disabilities. So disabled children aren't usually informed properly on sexual matters, so they don't understand what is acceptable and what is not. Communication problems make it difficult to consent or protest the action. They usually are unable to run away and are easily overpowered. Many can't have a lot of privacy because if they're left alone, that has some safety reasons that they are not allowed to do that. So I think it is really important to try to find a way to um, give disabled children a more crash course on sexual matters, and so they know what is acceptable and what is not, and how to communicate those feelings. This next slide is about sexual predators. So it is shown that a child that isn't able to report abuse is considered an attractive proposition for an abuser. Studies show that about 22% of sexual predators go after children that have some sort of disability. This is shown because of the fact that they can't communicate that they do want it to happen or they don't want it to happen. And so, unfortunately, as gross as it is and how hard it is to accept and process that, sometimes sexual predators go right after those children because they know that they can't tell them to stop and they can't they are easily overpowered and such. So, and then I also want to point out with trials, it is really hard because juries must make the decision that if a child with a medical complexity or disability is competent witness and how factual they are. This also ties in with their communication problems, pretty much how well they can hold up in court and how well they can try to explain the situation that has happened to them and the severity of it. So during one of my empirical articles, I found this 5 hypothesis. So the 5 steps that they go through is the first one is the level of a child abuse would be directly related to the intervention preferences of the social workers. 2 and 3 followed were that the more severe the challenging behavior of the child, the more the social workers will tend to use therapeutic and supportive interventions. The more social workers hold demanding attitudes towards the person with a disability, the more they will tend to choose authoritative interventions in cases of challenging behaviors on the part of the child and more. And then there is the um, address attitudes towards child abuse, stating that the more opposed the social worker are to the child abuse in general, the more they will tend to choose an authoritative intervention in cases of abuse by the parent and therapeutic consultation oriented intervention in response to challenging behaviors on the part of the child. So some studies done that will kind of show in the next couple slides is there was a study done with 59 social workers from welfare agencies and their discoveries. And then there was also a study done with 15 videos were developed to assess violent interactions between a child with a disability and a parent. So what causes the abuse? Abuse of a child with a disability often stem from an inability of parents to respond to the ongoing need of the child. This leads to frustration and sudden outbursts. So this also really reminds me of the communication issues where when their child with a disability can't communicate what is bothering them, it easily aggravates the parent and they lash out on those emotions. So welfare officers versus police officers. So welfare officers are obligated by law to report any cases of suspected abuse to the police, and then the police are obligated by law to consult a welfare officer in cases of suspected child abuse or neglect. This also is to abide by the welfare officer professional decision. So social worker intervention, the more severe the parental aggression, the higher the probability that social workers intervene. The effect of parental aggression of the choice of intervention was lowest for partial removal of the child after care. So after that, they kind of went in and saw what was most effective and what they thought would work best. So that was kind of the first. And then follow was assigning a home counselor. Then there was summoning parentings to counseling sessions involving the police. And then the last one was getting welfare officers involved. The strongest effect on parental violence was on the choice of authority intervention, specifically to a welfare officer and reporting to the police. So moving forward, I think a huge solution would be first to look at that spreadsheet that I provided and those 10 steps to really just understand how to communicate and how to really understand a child with a disability. I think that's a very strong first step to understanding how to communicate with them and how, like as a parent, not to get easily frustrated and how to know the best way to talk to them. And then the second thing I really think would be important is families with children with disabilities should have to take courses showing the difficulties of children with disabilities, especially with communication barriers. Again, I don't think that's a huge thing against any parent. I just think any parent with a disability child should really be informed on how crucial it is to find a way to communicate with that child in a way that's effective for you and that child. And then I think another really important thing would be when sexual assault awareness, you have lectures or courses that are taught, ask them to highlight the importance around disabled children. Because I think there's a lot of courses that talk about abuse and neglect in children, but I think there's not a lot of courses that really specify in children with disability because although there are a lot of similarities between, there's definitely some distinct differences between just regular children and children with disabilities. So I think it's really important for people to understand how to communicate with those children and find a way to make them most comfortable and to help them stop the abuse. Thank you. And this is my works cited. I cited all my images on the page, and then these are my 3 empirical sources and the book.